Look and feel your best. Our guest this morning can help you look years younger. He can give you tighter, more vibrant looking skin. He can make tired looking eyes bright again, and he can enhance your cheekbones. Dr. Vincent Voci is a board certified plastic surgeon and the founder of Voci Plastic Surgery. We welcome him to Charlotte today. It's wonderful to see you. Thanks for being here.
Oh, thank you for the invitation, Colleen. I appreciate it.
Of course. So we're talking today about facial rejuvenation surgery. And before we get to that, though, we should mention you want to remind people that you have a whole host of non-surgical options to help people look their best as well.
Yes, over the past 5 years, technology has just taken off. And sometimes it's an alternative, depending on the patient's expectations and needs. But mostly it's an adjunct to what we can do surgically. We have 12 brand new machines in the office that with laser, radio frequency, microfocused ultrasound. It's amazing.
Yeah, and those do wonders. If surgery if you're afraid of that or you're not ready for that, you should look into those laser options because they can do wonders to tighten your skin. Yes. But let's talk about surgery and the amazing results your patients are seeing. Dr. Voci, I know that this is really an art form to you, and you're all about natural looking results.
Right. It has to be natural. It can't look artificial. It can't look surgical. It can't look tight. And our technique of repositioning muscle and to help reposition skin, also reshaping naturally. Look at this. This is a beautiful result.
It's beautiful.
I'm so proud of this because if you didn't see the preoperative photograph, you would not know that postoperative photograph represents surgery.
You would not know she had surgery. That's correct, unless you'd seen the before picture.
Yeah,
she looks amazing.
And that's my goal every time, to erase the aging changes, but leave the personal characteristics alone. Sometimes you have to change the chin or the cheek or the ears or something, but most of the time you want to leave the personal characteristics alone.
Yeah, you want people to still look like themselves.
Absolutely.
Just refreshed and younger. Again, the results are dramatic, but they are natural.
And that was a brow lift and actually lower blepharoplasty, brow lift, and facelift. And this one adds the same thing. It's upper and lower eyelid surgery, facelift, but also we did a laser to get rid of the wrinkles. And really, it's 90 or something more percent reduction of wrinkles with the ablative laser at the same time as the surgery.
These are eye lifts too. I noticed their eyes look so much brighter and wider.
Yes, and this patient had upper and lower eyelid surgery, face and neck lift. And by the way, when I say facelift, I also mean the neck. It always goes with the facelift. And then that repositions and reshapes. And extra skin is gone, but the laser treats the wrinkles.
Golly, good work, Dr. Voci. I mean, it's spectacular. We should mention too, doing all of this, as you might expect, takes a little bit of time. I mean, we're talking a few hours in the operating room.
Many hours in the operating room, but it's all made safe by our certification and accreditation of our operating rooms to be the safest, and they can't be any safer. And we have board-certified doctor, anesthesiologist from Novant giving the anesthesia. I have a very talented, fantastic staff. And overnight, patients of all facelifts spend the night with a nurse, and I see them personally the next morning before they go home with their loved one or their caretaker.
Well, that's what we want. That's what we want.
This is another great example of just it's a repositioning and reshaping, taking away the aging changes, but leaving the natural pre-existing characteristic alone. Turning back time, but not changing the face.
She looks 20 years younger to me.
I'm very proud of that, and still natural.
That's a neck lift too? Is that why she looks even slimmer along the jawline and the mouth is not so downturned?
Yes, exactly. The muscles are repositioned, the excess fat along the jawline, the neck is removed. And it's a multi-vector, multi-directional reposition of muscle with permanent stitches, and that's what makes it so natural looking and also long-lasting.
It really, the results are natural. They don't have that artificial, plasticky look. It's really great.
That's very important to me and my patients. That's why most of my patients come to me.
Right. Talk about the recovery from a facelift.
It's amazing. If the patient follows the rules, they can fool everybody in the restaurant at 1 week. That's pretty amazing. Sandra, my wife, went to the opera 5 days post-op, upper blepharoplasty and facelift. No one knows that. They thought she had a cold. Because I told patients, please don't hug Sandra. I mean, other opera goers.
Right.
And then there may be 2 weeks back to an office, a business office setting, and then 3 weeks back to the gym. That's not bad, having all that surgery. This is the same patient again from the front. I'm just very, very proud of this result.
Well, I'm sure your patients are delighted. How long do these results last?
I'm very proud in that since this is a repositioning of muscle with permanent stitches on the inside, these results are lasting 13 to 15 years. And even when the patients come back and see me at 15 years, they look better than they did 15 years ago.
Right.
And that tells me that, and I'm very proud of this, the patients are aging on top of my facelift. My facelift's not going away.
Well, you've been doing this a long time, too.
Yeah, more than 15 years.
I mean, it really has. This might seem like a silly question, but are all your facelifts the same? I mean, I would venture to guess it's different depending on the patient and what they need.
Because some of the aging changes begin in the 30s. You know, I tell patients after the age of 26, your collagen starts doing this. And like a 35-year-old, very commonly will need maybe a brow lift, maybe a little fat reduction, and maybe some tightening of the muscle. 42-year-old may need just some skin repositioning and a little bit of fat removed here. And then by the age of early 50s, then you need the muscle repositioning, almost everyone.
Okay, really.
And this is just shows, again, those same patients before, and then the common denominator is beautiful, natural, long-lasting results. That's what we go for. That takes personal attention and to detail and anatomy and listening to the patients and what they expect.
Well, honestly, they look so good. Excellent work, Dr. Voci.
Thank you, Colleen.
So to make an appointment for a consultation, call Voci Plastic Surgery, 704-333-8300. I'll say it again, 704-333-8300. You can also log on to vociplasticsurgery.com. If you'd like to see even more examples of Dr. Voci's work, more before and after pictures, go to vociplasticsurgery.com. Nicely done, sir. Wonderful to see you.
Thank you, Colleen. Thank you again very much.
All right, well, coming